She's been called lazy since high school. This is his fourth antidepressant trial. She can't focus. They said it's ADHD. They've all been searching for answers for years. It's been hiding in plain sight. Narcolepsy type 1 is a chronic neurologic disorder rooted in the selective loss of a small population of cells in the lateral hypothalamus, the orexin-producing neurons. In a healthy brain, orexin neurons release the neuropeptides orexin A and orexin B, also known as hypocretin 1 and hypocretin 2. The signal acts at two receptors, orexin receptor type 1 and orexin receptor type 2. Orexin receptor type 2 plays a pivotal role in wakefulness, REM sleep regulation, and sleep-wake stability. Orexin receptor type 1 modulates reward processing, stress responses, and autonomic functions. Orexin neurons project broadly from the hypothalamus across the brain. Acting predominantly through orexin receptor type 2, they engage multiple neurotransmitter systems: noradrenergic, dopaminergic, serotonergic, histaminergic, cholinergic, and GABAergic. Together, these systems support wakefulness, muscle tone, mood, motivation, and smooth sleep-wake transitions in healthy individuals. These neurotransmitter pathways are also affected in psychiatric disorders such as depression, anxiety, or ADHD, which is part of why narcolepsy type 1 can look so similar and be misdiagnosed. In narcolepsy type 1, orexin neurons are deficient and orexin levels are low. Type 2 orexin receptors are left without their signal. This creates an abrupt switch-like shift. The clear separation between the normally distinct states of wake, non-REM sleep, and REM sleep decreases, allowing the brain to sometimes enter a borderline state that results in excessive daytime sleepiness, sleep attacks, sleep paralysis, and hypnagogic hallucinations. When cataplexy occurs, strong emotions activate circuits that normally stimulate orexin neurons. Loss of orexin disrupts the brain pathways that control REM sleep and muscle tone. This reduces the activity of GABAergic neurons that suppress REM sleep, while increasing the activity of glutamatergic neurons that cause muscle relaxation during REM sleep. This imbalance leads to sudden loss of muscle tone, or cataplexy. In many patients, cataplexy is far subtler than total collapse. A brief facial twitch or jaw drop, a few seconds of being unable to speak, a momentary head drop that resembles a quick nap. For clinicians, this means watching for those brief, easily missed losses of tone, especially during laughter or surprise, and helping patients plan around fall risk, driving safety, and other situations where sudden weakness could cause harm. Orexin receptor type 2 is highly expressed in the nuclei that orexin normally drives. That makes it the rational target for restoring coordinated arousal and sleep signals. Orexin receptor 2 selective agonists bind orexin receptor type 2 directly in regions that normally receive its input, delivering a targeted orexin-like signal that re-engages the wake systems that have gone quiet. With orexin receptor type 2 signaling restored, the root cause of narcolepsy is directly addressed. This approach has been shown to address more than sleepiness alone, including sleep attacks, cataplexy, REM-related symptoms, cognitive and mood symptoms, fragmented nighttime sleep, and the daily functioning challenges that remain a major unmet need for people living with narcolepsy type 1. Recognizing its manifestations early can turn years of missed symptoms into a path toward restored quality of life, safer daily function, and the chance for patients to feel like themselves again.